Hi friends, good evening. Once again welcome back to my channel Mogambika Nursing. Friends, here we are discussing questions for RRB nursing officer exam. Also these questions will helpful for your other nursing officer exam preparation. Here we are discussing previous year questions and answers. In the previous video we started staff nurse exam grade 2 question papers till 25 questions we discussed, and continuation of same question paper we can see. First question, deficiency of thiamine result in options. Option A, rickets. Option B, Wernicke's encephalopathy. Option C, scurvy. Option D, pernicious anemia. Thiamine is vitamin B1. Okay, its deficiency can cause Wernicke's encephalopathy. Option B is the correct answer over here. If suppose beriberi is there in your option, means that will also correct. Thiamine deficiency cause beriberi. And option A, rickets. Rickets in children's vitamin D deficiency cause rickets. In adult, osteomalacia. And option C, scurvy. Scurvy is due to deficiency of vitamin C. And pernicious anemia, option D, it is due to the deficiency of vitamin B12. Here the correct answer is option B, Wernicke's encephalopathy. Move on to the next question. The term applied to the wastewater which does not contain human excreta. Options. Option A, sewage. Option B, sewage. Option C, sludge. Option D, effluent. Question. The wastewater which does not contain human excreta is known as sewage. Option B is the correct answer. But sewage means sewage is the wastewater from the community. Mainly it contains solid and liquid excreta. Okay, mainly it is derived from house, street, yard, washing places, factories, that all sewage. Move on to the next question. The following ventilation system, air is forced into the room. Options. Option A, exhaust ventilation. Option B, balance ventilation. Option C, air conditioning. Option D, plenum ventilation. Question. In ventilation system, air is forced into the room is known as plenum ventilation. Option D is the correct answer. Move on to the next question. Podiatric medicine is a branch of medicine that concerned with the care and treatment of. Options. Option A, hands. Option B, skin. Option C, nerves. Option B, foot. Podiatric medicine is a branch of medicine that is concerned with care and treatment of foot. Option B is the correct answer. And the next question. Optimum level of fluoride in drinking water is between. Options. Option A, 0.2 to 0.4 ppm. Option B, 0.3 to 0.5. Option C, 0.4 to 0.8. Option D, 0.5 to 0.8. Question. Optimum level of fluoride in drinking water is between 0.5 to 0.8 ppm. Move on to the next question. Hardness of the water is due to the presence of. Options. Option A, nickels. Option B, phosphates. Option C, nitrates. Option D, bicarbonate. Hardness of water is due to the presence of bicarbonate. Option D is the correct answer. Move on to the next question. The best method of refuse dispersal in which a refuse is burned in trench or pits 3 feet deep for a period of varying from 3 to 6 months is known as. Options. Option A, controlled tipping. Option B, composting. Option C, dumping. Option D, incineration. Last option, incineration, means it's a type of burning. Refuses are burning. And dumping means the refuses are dumping in a low-lying area. That is keeping dump. Okay, that is dumping. And composting, option B. Composting is one of the method of combined disposal of refuse and night soil. Okay, this is also not a method of keeping refuse in buried in trenches or pits. Here, the refuse disposal which is keeping in a buried trenches or pits in 3 feet deep for a period of 3 to 6 months is known as controlled tipping. Okay, option A is the correct answer. And the next question. The following are the characteristics of a mentally healthy person except. Options. Option A, mentally healthy person feels comfortable about himself. Option B, mentally healthy person does not accept shortcomings. Option C, a mentally healthy person feels right towards others. Option D, a mentally healthy person is able to meet the demands of life. Question. Among this option, which one is not a characteristic feature of mentally healthy person? And the correct answer will come option B, a mentally healthy person does not accept shortcomings. Move on to the next question. A mental illness which is associated with undue and extreme suspicion and a progressive tendency to regard the whole world in a frame of delusion is. Options. Option A, schizophrenia. Option B, manic depressive disorder. Option C, paranoia. Option D, neurosis. Here the correct answer will come paranoia. Option C is the correct answer. And the next question. A name of mosquito that breed in dirty and polluted water is. Options. Option A, Anopheles. Option B, Culex. Option C, Aedes aegypti. Option D, Mansonia. Which mosquito is breed in polluted water? It is Culex mosquito. Option B is the correct answer. And the next question. Scabies is caused by. Options. Option A, tick. Option B, louse. Option C, itch mite. Option D, flea. Scabies is caused by itch mite. Option C is the correct answer. Move on to the next question. Health promotion is a specific intervention that come under. Options. Option A, primordial prevention. Option B, primary prevention. Option C, secondary prevention. Option D, tertiary prevention. Health promotion and specific protection is come under primary prevention. Option B is the correct answer. For example, general health promotion methods like health education, food fortification, lifestyle and behavior changes, environmental factors, this all health promotion methods. So it is coming under primary prevention. And the next question, antibody present in human milk is. Options. Option A, IgA. Option B, IgD. Option C, IgE. Option D, IgM. The antibody which is present in human milk is IgA. Option A is the correct answer. First option, IgA. IgA is secretory immunoglobulin which is present in mainly saliva, intestinal juice, tears, respiratory secretions and colostrum. So that is our correct answer. And IgD, second option. IgD is mainly present in the surface of B lymphocyte. Its function is to recognize the antigen. That is IgD. IgE is mainly concerned with anaphylaxis. And IgM, last option, which is mainly related to primary immune response. Okay, here antibody which is present in breast milk or colostrum is IgA. And the next question. Which of the following is not a type of precurrent disinfection? Options. Option A, hand washing. Option B, pasteurization of milk. Option C, disinfection of urine. Option D, disinfection of water by chlorine. Among this option, disinfection of urine is not coming under precurrent disinfection. Move on to the next question. Which of the following is not a method of inducing passive immunity? Options. Option A, administration of immunoglobulin. Option B, administration of vaccine. Option C, transfer of maternal antibodies across the placenta. Option D, transfer of lymphocyte. Question. Not a method of inducing passive immunity. Correct answer is option B, administration of vaccine. Move on to the next question. Which of the following vaccine is the least sensitive to heat? Options. Option A, BCG. Option B, hepatitis B. Option C, pentavalent. Option D, influenza. Which one is least sensitive, heat sensitive vaccine? Correct answer is option B, hepatitis B. And the next question. Which of the following is not an element of primary health care? Options. Option A, promotion of food supply. Option B, maternal and child care. Option C, provision of essential drug. Option D, prevention and control of epidemic disease. Among this, which is not a component of primary health care? It is prevention and control of epidemic disease. Option D is the correct answer. Promotion of food supply, maternal and child care, provision of essential drug, immunization, all coming under primary health care. Move on to the next question. Pulse polio immunization program was launched in India in the year. Options. Option A, 1995. Option B, 1996. Option C, 1997. Option D, 1999. And the correct answer is option A, 1995. And the next question. The incubation period of chickenpox is. Options. Option A, 10 to 14 days. Option B, 2 to 3 days. Option C, 14 to 16 days. Option D, 4 to 7 days. Chickenpox is caused by varicella zoster virus and its incubation period is 14 to 16 days. Its isolation record for chickenpox is 6 days after the onset of rash. That is also important point. So the incubation period over here, the correct answer is option C, 14 to 16 days. And the next question, which of the following is not a principle of primary health care? Options: option A, equitable distribution; option B, community involvement; option C, multi-sectorial approach; option D, education of people. Among this, which one is not a principle of primary health care? And the correct answer is education of people. Option D is the correct answer. And the next question, continuous scrutiny of the factors that determine the occurrence and distribution of disease is called. Options: option A, monitoring; option B, surveillance; option C, assessment; option D, epidemiology. The factor that determine the occurrence and distribution of disease is known as surveillance. Option B is the correct answer. Move on to the next question. The first case came into the attention of investigator is. Options: option A, primary case; option B, index case; option C, subclinical case; option D, typical case. And the correct answer is option B, index case is the first case that come into the attention of investigator is index case. Move on to the next question. Which of the following disease is transmitted by direct contact? Options: option A, measles; option B, tuberculosis; option C, leprosy; option D, typhoid. Among this, which disease is transmitted by direct contact? It is leprosy. Option C is the correct answer. And the next question, system of storage and transport of vaccine at low temperature from manufacture to actual vaccination site is by. Options: option A, vaccine carrier; option B, cold chain; option C, Iceland refrigerator; option D, refrigerator. From storage and transport of vaccine at low temperature from manufacture to actual vaccination site is known as cold chain. Option B is the correct answer. Move on to the next question. Which of the following vaccine must be stored in freezer compartment? Options: option A, BCG; option B, hepatitis; option C, measles; option D, DPT. So the vaccine which should be stored at freezer compartment is option C, measles. And the next question, an agent that destroy or inhibit the growth of infectious agent in living tissue is called. Options: option A, antiseptic; option B, disinfectant; option C, detergent; option D, deodorant. And the correct answer is it is antiseptic that destroy or inhibit the growth of infectious agent. Move on to the next question. Cold sponging is given to patient with fever when the temperature is more than. The options: option A, 36 degrees Celsius; option B, 37 degrees Celsius; option C, 38 degrees Celsius; and option D, 39 degrees Celsius. So cold sponging is given when the temperature is more than 39 degrees Celsius. Option D is the correct answer. So far here we discuss first 50 question and next 50 question is remaining, so that we can see in the next videos. If it is useful for your studies, please share my videos to your friend circle. I am preparing questions with previous question papers. After that we can see questions in subject wise.